Now it has become a necessity. Earlier it was an option. It was maybe a luxury, but today it's become a necessity. And that is where artificial intelligence is it's not going to replace the doctor. It's going to help the doctor take a very informed decision. We cannot go 100% digital. But still, what has happened is that because of COVID, you would realize that the percentage of people who've gone digital is very high.
Hi guys, this is Mini Divan and you're watching HealthSite and Inno.com. We prefaced 2020 and 2021 saying that anything is possible, but no one really saw this level of disrupting business and life as we all know it. Today we have with us Dr. Kirti Chadda, Chief Scientific Officer, Metropolis Lab. Hi Dr. Kirti, how are you?
Hello everyone. Hope you all are safe and good.
Doc, when we talk about the outlook or the future of healthcare industry, specifically in this year, 2022, the very first question that comes to my mind right now is, what are the trends that you think will pick up this year when it comes to the healthcare sector?
Yeah, so actually, it's quite interesting, Minnie, that these things had already started pre-pandemic. And I think what the pandemic has done is just catalyzed it, and catapulted it in a very, very accelerated pace. That is what has happened. So you'll not believe it, when the pandemic started, I was in the US giving a talk on digital pathology and artificial intelligence exactly at that very point in time, and got quarantined when I came back because returned from US. But that was when Metropolis had started looking at digitization, and we were the first lab to get accredited by the College of American Pathologists and by the NABL in India itself. So I think the trend had started, but yes, now it has become a necessity. Earlier it was an option. It was maybe a luxury, but today it's become a necessity. And what has really changed is the patient, the general population, the way they are looking at care, healthcare, their awareness, their accessibility. And hence, there is no option but for healthcare providers to respond. And to respond end to end, from the beginning till the end, what we call the last mile support. And anything that you say, is going to impact somewhere. So whether it is, the way they choose the test, the way they do the test, the way they get the results, the way the health records move, everything is going to change, has already changed, but will change dramatically, in 2022. And it will become center stage now. It will become the only way to do things.
Since we're talking about the healthcare advancements and AI, do you think that artificial intelligence is really the big future when it comes to healthcare sector as well?
Yes, it is. So when you look at both the segments, whether you see wellness or whether you see illness, right? Wellness is when you have an apparently normal person goes for his annual testing, health testing, diagnostics and radiology, pathology, and then he comes to certain conclusions. And based on that, the doctors start or do not start treatment and maintain a follow-up. Now, as of now, this is being done in a very, very subjective and objective manner. But how it is going to be bundled up into a health risk assessment score, the best way to do it is through artificial intelligence. Because you don't want the intelligence now only of one person, or you don't want the guess of only one person. You want a calculated risk, right? And you want to combine the intelligence of a whole lot of doctors, a whole lot of data. See, today the data is really screaming, and everybody has started, curating their, analyzing their data. So, this is all going to enter into health risk assessment scores, which is going to decide whether I have cardiac risk of X or, mental risk of X, whatever you want to talk about. And similarly, in the illness domain, now when you talk about illness, whether you talk about cancer, infection, anything, neurology, cardiology, wherever you go, there is a lot of artificial intelligence coming in there also. There are algorithms. Everybody is working on algorithms for a certain disease, for a certain patient subtype. And now it's no longer, when we look at a slide, we used to eyeball earlier. Now we are actually doing morphological assessments. We're actually doing scorings. And this is giving a very, very different level of personalized and customized treatment to the patient. Because remember, today in illness also, the patient has access to any drug, any surgery, any doctor, anywhere in the world. But how is he going to choose which is the best? That is going to get decided by a very clear result, which is objectively derived And it is based on algorithms and huge data analysis. And that is where artificial intelligence is going to, it's not going to replace the doctor, it's going to help the doctor take a very informed decision.
But since we're talking about, personalized and customized services, and we have seen the digital care solutions booming at the same time because of, per se, even post the pandemic and, the current situation. So, if we talk about the market of digital care solution, do you feel that there is anything in retrospect currently which has already flourished or which is already working for all of us considering the pandemic?
Yes, yes. See, today, even if you look at COVID, every day in the news, you see plastered the data, right? How is it coming from? It's coming from ICMR, which is a single source of truth. So no matter who is doing the test, where they are doing the test, the fact that it's all linked somewhere and it's in one place for everybody to refer has made such a huge difference. And Mini, this is what is going to play out, whether it's the National Digital Health Mission, whether it is the electronic health records, which are getting, so blockchain, right? Blockchain is entering into healthcare also. API integration. Today, we are integrating APIs with umpteen hospitals. So Metropolis caters to all the top 100, 200 hospitals in the country. But earlier, we were not integrated with them, right? Our LIMS used to not talk to their HIS. So there is a hospital lab information system and there is a lab information system. But they were not conversing with each other, right? But today, there are APIs being put so that these two can converse with each other. And how is this going to help? It's going to help the patient. Because unlike in the West, where everything is under one health number, in India, we are still to reach that point, and we are still dependent on the other institute or the other hospital or the other lab to provide that data. But if this data becomes free flowing, then the patient benefits, right? So this is how it's already happening today. And there are many conversations taking place around this. There are umpteen apps, right? Umpteen apps. Now you can have the apps, but are you integrating the apps? Again, integration is the key. So a lot of public-private, integrations, a lot of private integrations, and government, we've seen it all. All the government labs today are integrated with each other, right? So I think it's a very exciting phase, and it should be done very carefully because this is what is going to decide the next 10 to 20 years.
But, since we're talking about all of this and, we are in such a phase of evolution and progression, but wherever there is a progress in technology, there's always a hassle for commoners because not everyone is really tech savvy or not everyone has that sort of approach or that sort of per se hang of whatever is happening, or maybe it's not really for them. It might feel like it's not really meant for us. It might seem a difficult process altogether. So do you think along with the implementation or integration, there will be or there are already some measures or steps that's being taken in order to sort of take care of that strata of society so that it becomes easily accessible to all?
Yes. So see, we have these examples at home itself, right? I'm sure you'd be having a grandparent or a parent or a reluctant aunt or a reluctant uncle who refuses to go online, right? They still believe in the brick and mortar, model. So that is why you must have heard, many times from our, other members in my team and, our senior, the top management, our MD, who has, talked about how we are developing the brick and mortar model as well. And we're going to be opening 30 labs in the next, 90 labs in the next 30 months, which is really a big number, right? So we have to cater to this patient population. There is absolutely no doubt about it. We cannot go 100% digital. But still, what has happened is that because of COVID, you would realize that the percentage of people who've gone digital is very high, right? So even those who were away from digital, unfortunately had no option, holed away in their homes, they had to use the online models. And that is where, we are trying to make it very easy. So what Metropolis has done in many spheres, so we have something called as a smart report now. So it's very interesting. If you do a test, you can see your entire analysis and you get a smart report. And this is just by the click. So even if you know how to operate your phone, you just click on the link and you will be led to the report. So we're trying to make it very easy. Similarly, for the doctors, we have something called as MetroBot. So, all the time they cannot reach out to us. So they can just WhatsApp us. Like today, all the bankers are using that, right? Even salons are using that. Any service provider is today using a WhatsApp chatbot. So, we've also started that. And we are seeing, the pickup of it. And as you said very correctly, it's slow and it's steady and it's a lot of hesitation. But I think the idea is to, just assure people that we are here. Okay, so we yet have a very robust call center where people can call us, they can reach out to us. So that's not going anywhere. We're not going anywhere, but we're also going to be available online.
Having said that, apart from other diseases, surgeries, and all that is happening, in our world right now, we've also seen a rapid rise in the cases of mental health disorders. So how are we sort of planning to tap into that market?
Yeah, so we have a very robust division for this actually, which is called Neuro. So our chairman had a vision that the way there cannot be one specialist for everything, right? Like if you break a bone, you don't go to a gynecologist. Or if you're pregnant, you don't go to an orthopedician. Similarly, there cannot be one pathologist for everything. So we are the first lab to have gone into subspecialty pathology or super specialty pathology. We have 200 pathologists in Metropolis itself. And out of them, at least 75 are specialists in a particular area. Like I'm an oncopathologist, somebody will be a neuropathologist, somebody will be a pediatric pathologist, like that, so on and so forth. So we have a division called Neuro, and this, does only neurology. So whether it is mental health or whether it is very, very severe mental disorders, there are certain tests, which are done only with us. And we intend to, make that more robust, because what COVID has somewhere done is, it has affected our minds. Let's face it. All of us, it has affected all of us. And there are subtle signs. And, time is going to tell a longer story of chronic COVID. And, so that's how things are going to play out, as we go along. We've already seen a lot of it, in the Western countries where people were more secluded. Actually, Indians got saved because of the joint family concept and a lot of people in one house. But where there's been one person alone in one apartment for nearly a year, I mean, it's not surprising that some amount of mental health is going to creep in. But it's not something that cannot be taken care of, right? So you do a couple of tests and, you go to the right doctor and you can come out of it. It's not something so sinister. It can be dealt with. And we intend to, go there and deal with it.
Also, since, you just said that India is a land of innovators and, we in ourselves are, self-suffice. So do you think India is far ahead in terms of capital and market as compared to rest of the world, or are we still lacking?
See, whether you look at the vaccines, which we were supplying to the whole world, right? Or you look at the kits that we have come up with. So I think good R&D has happened, and R&D is very, very important. So I think every company, every lab, every hospital, every business must have an R&D wing. And we have strengthened our own right now. And we intend to work double in R&D space because it's very much required now. The way things are changing, you have to have one eye in front and one eye behind and just, autopilot the middle.
Yeah.
Because that is the way it has to be now. So yes, I mean, our numbers are amazing, right? I mean, no matter what it is, any good business idea takes on in India. It's because of the numbers. But at the same time, we should not fall short in quality, right? In healthcare, quality is most important. When you have a sick person at home, first thing that is on your mind is, am I going to get the good doctor? Am I going to get right treatment? Am I going to get right drugs? Is my report going to be 100% accurate? So I think we cannot keep, so while we look at the numbers and the business side, we can never, forget the patient side and the quality, because that is actually, the proof of the pudding is in eating it. You have to see a healthy patient in front of you who you were a part of the treatment and the diagnosis. And that is only when you feel satisfied.
Well, I think that's about it for now, Doc. I think this was very, very insightful. Thank you so much for giving us such wonderful insights towards the future of our healthcare sector. And I think all of us are just hoping that good things come soon. And, we get rid of all this situation, pandemic, disaster, and perhaps move and head towards progressive, healthcare infrastructure. So thank you for that.
I'm sure. Thank you. My pleasure and honor. Thank you.
Thank you for joining us. Thank you.